Hey everyone, Daniela here with Addo Aesthetics, and thank you for joining us for your weekly dose of inspiration, education, and encouragement. Today we're talking about melasma, which is a hormonally induced hyperpigmentation. Now, I should start off by saying that melasma is a chronic medical condition, so it needs to be diagnosed by a physician. It's out of our scope of practice to be able to diagnose that as estheticians, but it is a very common condition. So it's important for us to be aware of it, what it looks like, and what triggers it. So let's start with what it is. It's a hormonally induced hyperpigmentation. You may have heard it referred to as pregnancy mask, and it typically comes up in a very symmetrical patchy-like pattern. So we see it commonly on the forehead, around the eyes, and on the upper lip. Now, that doesn't mean that it doesn't show up in other places. Those are just the most common areas that we see it. So pregnancy mask, it gets that name because it is a hormonally induced hyperpigmentation. And a lot of times women first deal with melasma when they become pregnant. Now, that doesn't mean that that's the only way that you can get melasma. It's a very common condition, and we see it with women who start or stop birth control pills, women that go through menopause, or even women who are starting fertility treatments. So how do you deal with melasma? How do you address it? How do you treat it once you have it? Because it is a chronic condition, so that means that we can only lessen the appearance of it. We cannot completely get rid of it. So it's important to give our patients realistic expectations from the beginning. So I like to treat melasma with a combination of products and treatments. So a 4% hydroquinone, a skin brightener, is going to work incredibly well to lessen the appearance. If you're not into hydroquinone, not a hydroquinone fan, Skin Medica makes a product called Lightera. That's a wonderful product. It's had great results treating melasma. So using that in combination with chemical peels seems to be a kind of win-win situation dealing with this condition. So you want to be sure that you also avoid light and laser treatments. Anything heat related can stimulate melasma, can trigger it. So that means being in the sun, that means eating spicy foods, and that also means strenuous workouts. You may hear your patients complain that they notice that their pigmentation gets darker after a strenuous workout. So that's a telltale sign of melasma. If you work in a medical environment and you have a patient that you feel like has melasma, check with your medical director, have them diagnose it, and have them advise you on the best way to move forward. If you don't work in a medical environment and you think that what the pigmentation that your client has could be melasma, ask them if they've ever been diagnosed with melasma. If not, have them check with their physician to see what the best way is to move forward. Okay, so that's the basics of melasma. And now I want to hear from you. What treatments have you used and had success with in addressing your patients with melasma? Let me know in the comment section below. Until next time, keep making the world a more beautiful place, inside and out.